Yeah, good morning, everyone. It's for us a great pleasure to have you here in this webinar, and we want to show to you in two parts newest things of Ryonex and the bioresonance according to Paul Schmidt. Yeah, last time we stayed in person in Canada, and this time via webinar. Hopefully, next time in person again. What we want to show to you is, of course, a short overview, because we have at the moment, you can see that 47 countries in the world. We are supporting bioresonance according to Paul Schmidt, and especially in this year we got 5 new countries, and in several countries new registrations as a medical device. With the Polar and the PS10. This was for us, of course, a great honor and unbelievable, but true. After 4 years of registration and certification, we got the certification as a medical device in for the Polar and the PS10 in Russia. Unbelievable, of course, with this from our side, a stupid war. We have to wait until it ends, but when we are ready to support also all the Russian areas with our system. Therefore, great pleasure to have this now ready and available. Yeah, we have really a strong growth, especially in this year. So many new practitioners, medical doctors worldwide are working with our systems. And in regards to our strong study research, at the moment it happened a very interesting situation. Other companies are now coming to us and asking us to develop for them a device with our dipole antenna system to integrate that in their office of these companies. This is for us, of course, a honor, because very well-known, internationally well-known companies are interested in that, and it shows how important it is to have a good research and a good way of science in the company. Yeah. This is exactly what we want to push. And when Mr. Singh told you or talked about the new Polar for 025, the new PS10 Plus, this is also a point of this registration process, because the new devices are needed also for the registration. You know, the new medical device regulation is coming here in Europe, and to fulfill the requirements, there was a need to remodel also the Polar and the PS10 to fulfill these requirements. And it is our strong will, really, to be a medical device producer in the world, also in the future, and therefore we are working hard. And what I can say to you now is that all the devices, it means the new Polar 4025 and the new PS10 Plus, is fulfilling all the technical requirements of this new MDR. Therefore, these devices are now, we can say, MDR ready. We are very happy about that. And in the next, I would say, 2.5 years, we have to show to our notified body, this is a German TÜV, that we are getting, under the new regulation, the newest certificates. At the moment, the certificate we are having is up to 2028, therefore enough time to find this or to get this MDR certificates. Very important for us are studies, double-blind studies. There are WHS study in reducing pain. And we have to show in the meantime, especially in regards to the MDR, how this system is working, not only how the system produces frequencies with which we can stimulate the body and the organism. We have also to show what is the mechanism that our system can reduce at the final end this pain. And this pain reduction was exactly part of this double-blind randomized study. Then we checked with placebo devices, you can see in the picture on the left side, and the Verum device, which is working on the right-hand side, the devices we checked, and at the final end, we got fantastic results after unblinding the data. It was clear that under the influence, only under the influence of the Verum Rayocomp device, we can reduce the pain. You can see that here on the left hand side of this diagram. It was possible to reduce really with the Rayocomp the pain, but it was not possible after unblinding the data with a placebo device. And this chart makes us to a medical device producer. Yeah, and of course, we are having so many different other studies, and more studies are on the way. And about the result of one study, I can give you a little bit more information in this webinar. Only as an overview, we started in '93 with a study with more than 500 patients, and the idea in '93 was to find out that standardized programs can be used for standardized illnesses. That means when you are having for example, problems with the lung, is it possible to treat with the same program these patients with success? And this was exactly the idea of this study. And Dr. Breyer worked it out with more than 500 patients, as I said already, and it worked really proper. Today, this knowledge is the fundament of the RAH usage, and therefore you can see how many things must be created to get really this research and the results. Yeah, then we started in 2011 with cell biological studies with the Fraunhofer Institute. I would say this is a very well-known study, and the most important outcome of this study was that under this influence, we worked out that our frequencies are not able to hurt cells. It means to push it, to activate the cell metabolism, to activate the cell vitality and also the cell regeneration, but not to change it from the morphologic structure. And that was very important. Yeah, DARCH was then the next step, also in vitro studies with cell biological investigations. And in the meantime, with DARCH, we created more than 30 cell biological studies, especially to work out the parameterization of our system and to find out how it is working, why it is working, and how we can optimize the working of our dipole antenna systems. Yeah, Dr. Fied is also this cardiologist in Chemnitz, and he had an observation of cardiac problems with, from my point of view, unbelievable results. And of course, this was very helpful to show that our devices are able to treat different kind of diseases. Yeah, and then in 2019, the clinical prospective double-blind randomized study with Dr. Schüssler, the report and the result was shown a chart before. This is the most important study we are having at the moment here. at Rionex because it is a gold standard study. Yeah, and then in 2021, I started with my doctorate, and in the doctorate with the title of Design, Simulation and Validation of Dipole Antennas for Biomedical Use. It was also of interest to show that our system is not working only with fibroblasts, for example, also with other kind of cell structures. And this was the first study of intestinal cells. And with these intestinal cells, it was possible to show that with our system, we are able to stimulate really different kind of cells of different organs in this way of the colon, and it was the fundament of the next study, which was made on the university where I lectured bioresonance according to Paul Schmidt, and then they started on the fundament of this American journal study, an in vivo study with patients. And with the calprotectin value, we can show in the stool that under the influence of our treatments, the inflammation or the inflammatory diseases was really reduced. And this was a great result for us. This was very new, 2024, in the last year. And then in the last year also, for us as a big surprise, a study we can't believe. It was a study made in Japan of hormonal hair loss of women over 40 years old. And when you can see the results of this study, I would say an artificial intelligent microscope counted the hairs and shows clearly that under the influence of our treatment, really the hairs was as a higher or a bigger diameter, and the number of hairs was increased, and therefore also a very interesting thing. It was not a launch from us; it was an independent one in Japan. Yeah. Therefore, this was the last one, and of course, I have new ones, and I want to talk to you after a few slides. But I want to show to you again here this very nice possibility to see what we are doing. It means our devices are producing sinusoidal frequencies, and with these sinusoidal frequencies, we can stimulate exactly these cells, increase the cell metabolism, cell vitality, and also the cell regeneration. And I would say this nice visualization shows exactly what you are or what we are doing with our devices and what you are doing with your patients when you are using our devices. It means the pure stimulation of cells. And this is an animation, and this is, of course, directly the microscope. And you can see on the left side a placebo. It means no dipole antennas. On the right side, dipole antennas. And under the influence of these dipole antennas, this cell regeneration was much higher. You can see that this, I would say, wound heals faster. On the left side, there is a wound. On the right side, it is already healed. And under the influence of our system, we treat more than 20% faster than before. Yeah, and all these things were of great interest when we started with this research of the doctorate. And this time is the first time that I can show to you also news results, because now the patent is pending. And you know, before a patent is pending, you cannot talk about the results, but we are having now this patent pending situation. Therefore, I can show to you some new results. we looked to the mathematic fundament of our dipole antennas, and we are now able to explain exactly how the dipole antenna is functioning, how the E field, the electric field, is produced, that this field is leaving the antennas, the frequency is produced, and with this emitting frequencies, we are able to stimulate the cells. And this is the visualization so that you can imagine what our dipole antennas do. They are emitting sinusoidal frequencies to the body. And this is totally important to know. And this is, I will say, the reason why with our system it is impossible to hurt the body, because only sinusoidal frequencies are harmonious ones and can stimulate the body in the right way. The same frequency on a, I would say, rectangular waveform or impulse modulated waveform produce at the final end problems and stops the regulation of cells. I will show to you this a little bit later. Yeah, and when we are simulating in the doctorate here our dipole antennas, you can see in the middle like a mini Ryonex, and this is the field around. And this is a field which is around 2 meters. And when you are using, for example, my mini here on the working place here on the desk, and I have it permanently in front of me, and then I'm completely with my body in this field so that it can stimulate me and help to regenerate and to produce a higher cell vitality. Yeah, and we did a research about how this dipole antenna system is working, that really the frequencies are changing when we are changing the dipole antennas in the devices. You can hear this as a noise when the engines are fixing the dipole antennas into a new position. And therefore this was done. And then the most interesting question was, when we are having here a mini Ryonex, I have to show this here, there is no battery in it, there is no USB hub, there's no connection. How can it be that this device is working and working over centuries? We have devices which are older than 30 years, and they are working fantastic. And you can see here in this simulation how our system is working. In a radiation field which is existing around the mini Ryonex, the dipole antennas are absorbing the frequencies and reflecting it back exactly to the body. And this is working also in the devices. We have the dipole antenna, we have then a plate under these dipole antennas, and so that the reflected frequencies are coming to this plate, and from this position we can use a cable connection to the detector to the body. That is the way. And the drawing on the right side is exactly what you can see, and so that you can imagine how it is working. It means the dipole antennas are reflecting a sinusoidal resonance frequency back to the body. And this is part of the patent, because we never found in the literature exactly this effect. And this is the effect and the reason why our system is working in the car, on the ship, in the skyscraper, and wherever, without a problem. Therefore, a very robust system which is working all over the time. Now, what I want to show to you is also the newest study. And this is for us very important, because especially athletes will be very interested in that. But also this study is an explanation why I will say the ability of the organism is much higher in relationship to cell metabolism to cell vitality and regeneration. It means what we try to find out here on the university in Germany with an institute of sport is to find out the oxygen availability in the organism. And we had a research at first with 6 patients, and it was in a way that a part of them were not very well trained, and they had a value of 35 or 42 milliliter per minute per kilogram. And when we are using our bioresonance, it was possible to increase the oxygen availability in the body up to 11%. And this was really a very, very big surprise for them. And you can see under U1, there was one athlete from the soccer league. And you can see when the person is well trained, they are having, I would say, 80 milliliter of oxygen per minute and kilogram. And normally in this level, the trainers are fighting for each % of more oxygen availability. And when we had this study, we were able to bring it up to 86, what means that this is more than 7.5% higher. And in the same time, without the devices, no changing. It means it is really, it was a blinded study, and we want really now to create from that a study which is clinical prospective and double-blind randomized, because all the area of people who are doing sports are having a big positive result of this treatment, because the oxygen availability is much higher, and therefore they can run faster, they can jump higher, or whatever that they want to do. And therefore, this is the first step, I would say, into a complete new area. Therefore, very, very great. And when you are treating athletes, you can use that also to push them to a higher level. Okay. In the same way, we had a research on water, and this was for us very important because we want to show the influence of impulse modulated frequencies. And we did for that especially research to show, firstly, that water really can store frequencies, and that water can store harmonic or impulse modulated frequencies. And you can see on the pictures on the left side, on the left-hand side, that we are having glass probes B on the cell phone, a 5G cell phone, and then giving 2 hours of a phone call to this water. And the second step was to have this water bottle, yes, this container, on this cell phone with a mini Ryonex at the same time, 2 hours. And the last trial was to have water from B only on a mini Ryonex 5G, and to see how is now the functioning. And what we did is that we give this part of this kind of water into the nutrition solution of our in vitro studies, and only this 25% part of water changed the ability of the cells dramatically. You can see that here. It means A was the baseline. Yeah, this was only normal tap water. B was water in the nutrition solution for the cells, which was, I would say, contaminated for 2 hours in the glass container. And this reduced the ability for cell regeneration dramatically. Very, very interesting, when you are using both, that means exactly what we are doing. One pocket, the cell phone, the other pocket, the mini Ryonex, then the sinusoidal frequencies from our mini Ryonex, I would say, are balancing completely the negative influence of the impulse modulated frequencies of the cell phone. And this was a very, very nice surprise. And when we are, I would say, treating with our mini Ryonex 5G the water from B, which was the trial of D, it comes back to, I would say, a normal functioning water like tap water on A. And that shows that water can really store frequencies, that water can also store the condition, I will say, if it is a sinusoidal or an impulse modulated radiation, and therefore this worked really absolutely proper. And we were really very happy. And therefore we created for that especially the new Rayo Aqua product line. You can see this like here with a carafe. And in this Rayo Aqua, you can see it on white and in black. We are having exactly this dipole antenna system with which you can inform water. This is here, for example, on my desk, exactly what I'm doing here, with the mini Ryonex, with the Rayo Aqua device with the same dipole antenna system in it. Okay, that was from my side point. I want only to say a few things about the extension kit. In the beginning of this presentation, I said to you that we are very, very happy now to have the new Polar 4025 with the newest features, developments, the newest RAH programs and everything, the new data bank, a new panel PC, a new touch screen, much faster, new functioning in the scan, and whatever, copying the patient's data and storing that, for example, to an USB stick and whatever. And that is now available. And of course, the availability is also that we offer to change an existing Polar 40 into a new Polar 4025. I think Arman Singh will then inform you about details and in case that you are having an interest in that. Yeah, and the PS10 Plus is in the meantime more than a half a year in the market, and we are not able to produce enough quantities at the moment. We are permanently working on the list of upgrades, and it is our hope to finish that in September, and then to start with remodeling processes. In the meantime, I think we produced, nearly 1,000 pieces or so. And therefore, very, very successful, and our users worldwide are totally happy with that. The biggest advantages are a very fast RAH now. You can see the extension kit here in the picture. It is under the PS10, yes. And an internet update is possible for new programs directly at your home or at your clinic. The battery runtime is more than 20 hours. All existing RAH programs and all new RAH programs can be used. An upgrade is possible, and this is for us very important because we want to reduce and avoid e-waste. And therefore, when you are giving us the device back, you are changing that. We have, of course, the possibility to work with that to reduce the e-waste. Yeah, and of course, it is prepared for new future features. And what you can see here is definitely the future of Ryonex and the Bioresonance, according to Paul Schmidt, in the PS10 sector. Yeah, and with that, we are, I would say, really ready for the future. Very happy to have all these things now done so that we can focus on the market and focus on the users and focus on new RH programs and the users and the usage. And this is exactly what we want to show to you. And Ms. Bunkenburg will now show to you in her presentation what you can do on the topic she wants to present now. Okay, thank you so much. And I will stop that here. And you, Ms. Bunkenburg, can now start your presentation.
Yes, I try to share it with you.
Hopefully your data line is better than my one.
Okay, but first, do we ask about questions or not, Armand?
Yes. Yeah. Thank you, Professor Heimes, for your presentation. And I have already some questions here. And if anyone have any questions, they can write in the Q&A session, and I'll speak out, and then Professor Heimes can answer those questions. So related to Professor Heimes' presentation, I have one question so far, asking what is the difference between with the new upgraded Polar than the older? Do new machines perform better? I would say we cover in both cases, Polars and PS10s. So do they perform better?
Yeah, it means the performance of the devices is also related to the RH programs, to the exactness, to everything. And therefore, what is the question of to perform? To perform in relationship to the success you are having with the patient. Yeah, and I think Ms. Bunkenburg will show exactly now what we can do with that.
Yes. Mm-hmm. Yeah. Before I continue, I have one more question, which obviously I can answer. Is the device available in Canada, and is it legal? So at the moment, yes, all the Ryonex devices are available in Canada, the Rheocom PS10 and the Polar, both for professional and personal use. They are classified under as a wellness device, as a non-medical device, but yes, they are available for personal use. Yeah.
Okay, great.
Okay, all right. So yes, and next, yes, again, I'll welcome to Mrs. Bunkenburg, and then she will start her side of presentation, which will again cover the topics. The major topic is our cell degeneration and atopic diseases.
Yes, thank you so much. Hopefully everybody can see that now. Is it possible to see the first slide? The energetic support? Yes. Oh, okay. Yeah. Hopefully it runs. Warm welcome also from my side. Thank you, Professor Heimes, for the first part. I think for everybody it's so important to know what is behind bioresonance according to Paul Schmidt and the technical part, but more and more we have to show in a scientific way that it's working. And when we talk together from one practitioner to another, then it's clear that it's working. But more and more we have the problem, or what, not a problem, but more patients are asking what is behind it, and for creating trust, and that you have really all the possibilities to work with the system and with the patient. Therefore, we need all these scientific things for showing how it's working. But today, my aim is to give you ideas about atopic diseases, how to treat with our system, because you have so many possibilities, and therefore it might be interesting for you to have a little bit red line through this disease. And also, let's have a look at cell degeneration, cancer patient, how to support them, and what we can look in the future, for example, how we can support them. Okay, now I change. Is it next slide for you to see? Armand, you can see next one? Second?
Perfect.
Oh, Okay, sorry for asking first,
Yes.
but sometimes I'm not sure because of the technique. Atopy is general. It's a genetic predisposition to develop allergic diseases. And when we talk about that, we have a little bit to explain what is it. When we talk about the immune system and the special reaction with IgE antibodies, then we are very close to atopy diseases. And first time, I think, when you are in contact, for example, with harmless substance, then you have the thing, you have the possibility, or what happened, it happens then it's triggering an alarm in the body. It's triggering an overreaction. And this kind of overreaction is not easy to treat. And I want to show you a little bit the backgrounds. The genetic predisposition, the people were born with this genetic predisposition for atopy, and therefore they cannot change, and we have to find out, and then we have to find out solutions. The next thing is an overactive immune system. And that, I think, is so interesting for you, because meanwhile, every therapist has to ask himself why we have the situation that the immune system is reacting stronger and stronger. And there are several courses. And with our system, we are so happy to find out what are the reasons for this kind of overreactions. And therefore, step by step, I want to show you that you can select, that you can find out the reason, that you can, for example, reduce or avoid trigger, and therefore that is very helpful for this kind of patients. Atopic diseases, depending on the stage of life, they are changing. And I think that is very interesting for you to know. Infancy, mostly they start with atopic dermatitis and with food allergies. That means that we have the skin involved in this problem and the digestive system. But childhood, then they develop hay fever or allergic rhinitis. That is upper respiratory system is also a little bit involved. But hay fever, as you know, many people have more and more. And then in adulthood, it's mostly bronchial asthma. So we have these four possibilities. And okay, when you have the patient in front of you, then it's easy to decide which one is it. But please ask these patients. For example, when you have somebody with asthma in front of you, asthma, bronchial asthma, we have very often with our system, but please ask these patients about their skin and about their history. And that is for you the big chance to find out, is it really because of the predisposition, the genetic problem, or is it only because of, for example, the environment or because of infection that asthma is developing? In case that you are asking your patient and your patient said, yes, you're right. When I was a baby, I had, for example, atopic dermatitis, or I had kind of dermatitis. And yes, you're right, it's changing. Then you have really somebody in front of you. And my recommendation is really start working with him. But best idea is really to check these people 4 times a year. It makes no sense only to work on one part of this atopic problem. For example, at the bronchial asthma, it makes really sense to check them very often, 4 times a year is perfect, and to take care, for example, for the digestive system, but also for the skin. For me, it's clear now that you have to take care for all these parts of the organism, and not only to, for example, to focus on the bronchial asthma at the upper respiratory system. It's very helpful to take care for more. Okay, we have, for example, when we talked about the skin problems, we have neurodermatitis very often, atopic eczema, or the other name is neurodermatitis. We have the hay fever or allergic rhinitis. We have the bronchial asthma, and we have the food allergies. And all these things, food allergies, mostly with these patients are related to peanuts, to milk, or to eggs. I think mostly you know that. Every time, once again, you have such a patient, please ask about the skin and all the history behind it. That is for you the key to find out what kind of patient I have in front of me. Only to explain the allergic reaction, what is happening in the organism. When the body is in contact, for example, with an allergen, first time nothing happens. Sensitizations, upon first contact, the immune system is producing the antibodies, the special antibodies, and they are sitting to the mast cells. That you can see that on the picture on the right, you have the cell, and then you have the antibodies on this cell. Nothing happens. But next time, second contact, that is the start of the allergic reaction. And the antibodies give the start for producing the cells, for example, histamine. And what happened when you are producing histamine inside of the body, then you become the symptoms as sneezing, itching, skin rash, or breathing problems. And that is the systematic thing behind this allergy. Very easy to understand, but for the people really not easy to handle. Let's have a look what is possible with our energetic support with bioresonance according to Prof. Rhioscan, if you have the possibility and you have a Rhioscan, sorry to say that, but I like to do that test very much because it's the first time that you have not therapists checking what is the problem, for example, with the Rhiosensor, is it a problem or not? The frequencies are directly given to the organism. And the patient, the organism of the patient, is deciding, I need these frequencies for support or not. And therefore, it's for me the most individual test. And it's so interesting how the people or the organisms are reacting and what is possible with such kind of treatments. But I want to say to you, one thing is the Rhioscan for using, but for sure you can also use the Rhiosensor. First thing is to check, and when I'm talking about allergy problems, strong problems, my recommendation is not only to check with the RH, it's also possible, or it's helpful to check with bioresonance according to Prof. with the BAPs, with the single frequencies. And also this is with the Rhioscan very quick to do. You are starting a BAPS scan and it's all the frequencies are given to the organism. And we take 68 from this scan result for regulating the organism. What we want to do is that we push the self-regulation because we know, meanwhile, we are working more than 14 years with the market and with the system and with thousands of therapists. The fingerprint, the individual fingerprint can regulate self-regulation and can push it. And with such strong things, strong diseases and problems, it makes really sense to support first with the fingerprint and then to go to the RH. You can store on the green card both. You can store the single frequencies and the RH programs. Therefore, my first thing is BAPS scan, green card, or you make a range value test and store it on the green card. And then you can check with a scan. You can, for example, with neurodermatitis, you can go directly to the physiology in case that it's not on the top, but you have all the symptoms, itching skin, for example. And then when at the end, when you have the therapy program, you can add our pathology program if it's not inside. Both you can save on the green card, and then you have on the green card a very nice therapy program. First thing, BAPS with supporting self-regulation, and then directly to the point, the skin problems we want to energetically support with the RH. Okay. 5 minutes harmonization time is normal, it's really enough. When you have inside of such kind of program a 70 program, hopefully you know 70 programs, then you need a little bit more time, 10 minutes, because they are very big and lots of frequencies inside. But almost all the other frequencies, therefore 5 minutes is enough. When you are working with a scan, then it's so interesting what are the questions from the practitioners. Because, for example, they are describing, they said, okay, now I have a skin problem and itching skin, and it's really clear that it's neurodermatitis. and I'm making a scan with a radioscan and an RAH scan. And what at the end, on the top, there is the immune system. That is not the skin. And why is it? Is it working? Is it in function? And the people are really confused sometimes because they are waiting for the skin. Because in their idea is skin, biggest problem that must be on the top. But really, we have to learn to understand this scan because we are checking the energetic problem in the body. And for example, when you are thinking a little bit about this neurodermatitis and what is behind it, the immune system is, for example, the problem because you have an reaction of the immune system. And therefore, it might be possible that first on top is the immune system. But what happens when you are balancing the immune system? Please believe me, the energetic system is finding out the best way for you. It might be possible that first thing, immune system regulated makes more sense than going to the skin. And sometimes really we have to learn this kind of thinking. I had a group of medical doctors in Israel, and they had, for example, a problem with the virus. It's the nervous system. And they asked me, why not the nervous system is coming on the top? And why, for example, the detoxification, the kidney is coming? And then after asking a lot of questions, we found out elderly people, a lot of strong medication, painkiller, all these things. That was the reason, because that the patient, the organism was reacting with problems in detox, kidneys. Therefore, recommendation of the device, of the fantastic device, is first take care for detox and then let's have a look at the nervous system. And the same way, please don't wonder if you have neurodermatitis and on top is the immune system. That is the recommendation you have to regulate first. Same thing is hormonal system, for example, that you can say, okay, hormonal system, we are talking about skin, but think about all the hormones. What are hormones doing to the skin? And what kind is the function in case that there you have it dysregulated, the hormonal system? That might be the reason why the skin is reacting in such a strong way. Therefore, it's it's sometimes you have a little bit to think about it, but it might be possible that hormonal system is more important first for harmonizing. Nervous system, in case that you have not or too much neurotransmitter, that's also a problem for the skin and it's promoting inflammation. And also the nervous system can be the trigger for a strong reaction to the skin. Sure, you have to work on the skin, but what is best? First, to reduce these promoting inflammation factors or directly to the skin. Same thing with digestive system. Really, sometimes the people are asking, what you want to tell me? Because digestive system, we have no stomach problems, we have skin problems. But meanwhile, we know that if you have a problem in the gut with the microbiome, many problems are coming to the skin, because also there we have a lot of problems with inflammatory parts. And sometimes really it makes more sense first to regulate this part, then go to the skin. That is only to give you a little bit an idea how the scan is working. And in case that it's not clear for you, you have a radioscan, you are so happy, but you are not happy with the results or with the interpretation, please come to us or give these questions to Arman, and we organize another kind of meeting like this here, and we can discuss. Okay, that was the radioscan, but we have so many more possibilities. Compact programs. What do you think, compact programs? Compact programs, are they important or not? Compact programs are meanwhile so important because they are proven, and for example, Professor Heimes told us from the studies. And inside of the studies, when we are working together with the practitioners, with the therapists, and for example, like in Japan, they want to start a study, then they are asking about a program. Because in a study, it's not possible to check the patients, the participants of this study individual. And we have to develop one program, and this program is given to the patient, to all these patients. And then we are waiting for the result. And therefore, we have meanwhile lots of compact programs proven from the scientific way in the studies of all these people. Therefore, please, you can check individual, but you can also use these compact programs. They are really made with a lot of experiences, and they are working successful. And sometimes really we have not to find out everything in a new way. You can use and have a look what happens. For example, with neurodermatitis, every time we start in this kind of programs with giving energy, because energy is really the key for our therapy. We are balancing, for example, the ATPs, especially here with the neurodermatitis for the skin. We give a lot of power. You saw the video first, that we can give the energy to the mitochondria, and they are producing the energy, and therefore we push energy support. And then we go step by step to the physiology part, to the pathology part, and we go at the end to detoxification. And as you can see here with neurodermatitis, it's also stress reduction inside. Because psyche and stress are also trigger for neurodermatitis. And it's so interesting, really, I can only say that to you, please try it. It's reducing a lot of symptoms, and that is so helpful for the people. And if you want to individualize this, then you can put, for example, on the protection card, on the protection cup, a little bit saliva or something from the patient. Then you have automatically, on the one side, you're running the compact program, and on the other side, you have the individual programs like an additional program to the compact program. That's it. I think for me, it's really perfect to do that in that way. And please, my recommendation is every second day. In the past, really, we said, okay, when you have problems, once a week or 2 times a week. But meanwhile, we have so strong burdens, and it makes really sense to support more than only 1 or 2 times a week. And we learned in Corona times that the home therapy is perfect for all these kind of treatments. When you have a basic at home, you have the treatment card, and then the people are really doing that every second day. They can they can do it when they want to do it. They can integrate in their life. And it seems to be that that's the reason why we are so successful at the moment, and we get so good feedbacks from all these practitioners and also from the patients. Okay, when we talked about the test protocol, that is easy to use because of indication. But when you really want to try to find out what is behind it and you want to check all the programs, then I can really give you the idea of the test protocol to use it. In the test protocol, it's really like a guideline. We have, meanwhile, so many programs in the RIH, I think more than 3,000. And when you're checking everybody with all these programs, it took so long. And therefore, it makes sense to have a test protocol, only the most important ones, but that you cannot forget the most important, and that you try really all the things you need. And therefore, we have also for neurodermatitis the whole test protocol. Professor Heimes talked about the PS10 Plus and the extension kit. He explained it, that it's now under this PS10. And please remember, in the past, we had to reduce in the PS10 the test protocols because it was not possible for us to offer with the new programs and to make them bigger and bigger because we had not the possibilities. Therefore, now with the new extension kit, it's open. It's really like a new start because we have so many new ideas, but also new test protocols, and the test protocols are growing. And therefore, please, you're welcome to use all these test protocols again with the extension kit. Otherwise, it was not possible because in the Polar, we have a lot of space and we can integrate. And please believe me, we have so many ideas. We don't want to stop to integrate possibilities for you for testing and harmonizing. Therefore, extension kit is the door opener for the new test protocols and many, many new things. Working with the test protocol, only save the strong disturbance, because otherwise the therapy program is too long. Save it to the green cast, harmonization every second day. And then my recommendation, or our recommendation meanwhile, is to go to home therapy, because home therapy, we have more possibilities. Okay, when we say we have to find out the causes, what are the causes behind all these problems? When the people are reacting, for example, with asthmatic problems, they're coughing, for example, or with skin problems. It's so nice to know that we can offer you with our global test all these causes, and you can check. Step by step, you have to find out what is behind it. And finding out these problems and reducing, that is for you the first step in the right way, in the direction of healing this person. And the energetic possibility, I think you have so big possibilities there behind it. It's easy. It's not producing pain when you check, for example, the children. Because remember, when we said mostly with the Atopy, they start with skin problems. And it's not nice to make such a kind of test with babies, for example, or very small childs. Therefore, energetic test is very easy to do, and you have really interesting results you can find out, and then you can reduce or you can harmonize. In the future, we want also to offer that in the rhioscan, because it is one part you have really at the moment to do with the rhiotensor. But in the future, you can also have a look at the pollen, at all these things, at the colors, or what is inside of everybody's thing we are eating, and then you can find out which one is a trigger for the skin problem, for example, automatically. Yes, and energetic support with neurodermatitis, and we have also to talk about our nutrition. We have, first thing, most important, when we have the picture all over, is checking. It depends on you. Bioresonance according to Paul Schmidt, range value test, or you use the scan, or you analyze with the rhiotensor in the RIH. But then you have to take care, because these people need more support. And we have to talk about Rhiobase, Rhioflora, Rhiovita, or also Rhiosol Plus. The people have a little bit to change, because when they are eating the wrong things, then, for example, when we talk about the skin, you have directly inflammatory effects. And therefore, you have to talk about the nutrition, and you have to give them a recommendation that they have to change in that way, that they have more antioxidants-rich food, for example, more fruit and vegetables. And the good olive oil, or for example, avocado, are the healing fats, really needed fats for no inflammation, for a good wound healing. You need zinc, for example. Zinc is for wound healing, and it's strengthening the skin barrier, and it's also anti-inflammatory. But also biotin, vitamin B7, is very, very important. Magnesium, it's the same thing. And all these things together are helpful. And when you are making, for example, a scan, rhioscan, then you can see that mostly in the result. That they need, for example, this one, that is an over-acidity inside, and all these things. Then it's easy for you to explain to people, but otherwise you have really to ask, and you have to recommend what they can do, and that they can support a little bit more the organism. And next energetic support, I think a very nice way is, for example, the alkaline baths. As you know, Rhiosol Plus, we are offering, and especially for neurodermatitis, it's so easy to see that the people are like to have this support, because neutralizing of hyperacidity is very easy, and it's the most important effect of this product. And the promoting of the skin regeneration, the regulating of the pH value is very welcome because of natural regeneration. And when you have a damaged skin and you go in these bars, and after, for example, 1 hour, it makes sense really to have a long bars. You come out and you are making a little bit that it's not wet. You're drying it a little bit, but mostly when you ask the people, they like to have it. They enjoy this kind of bars with the temperature. And additional to Cryosol Plus, you can also give the treatment program in the water. And then the people are lying in the water, very relaxed. They have the frequencies surrounding the organism. You can optimal regulate the pH value, and the effects are really, really nice. The reducing of itching, for example, is one of the effects. You can push the detoxification and relieve the skin, and really balancing the skin makes sense that it's that the skin is becomes more back to a natural barrier. That is so important. Please try, and you will wonder because the effect is really nice. Okay, let's talk a little bit about the ryotabs. I'm not sure if you know them or if you use them, but when I have a patient in front of me and I know that he has a lot of problems, he starts with neurodermatitis and now he develops, for example, the problems with the digestive system or also with the bronchitis, with asthma, then I really have to think about best support. And best support means, for example, also to check with ryotabs. First of all, when you want to use the ryotabs, check if the ryotabs are really, if the people can take it. You can do that with our device. And then it's so nice that you only add the ryotabs to your treatment program, and you can transfer the information to the tabs. And what you are doing is really that you are producing kind of medicine, because the information are on the ryotabs, and our recommendation is 14 days. Then it's perfect and the information is very strong. After 14 days, for example, please make it new. That's our recommendation because of the effect. Then it's so strong. And 3 ryotabs daily, and that is perfect possibility for an additional support to the treatment, the bath, the treatment, the finding out the right diet, for example. And now we have the tabs. In case that you don't want to give the tabs, it's also possible that you can give this information to oil. Oil is also very nice for skin problems, or to water. Water is, every time it's a good recommendation to drink a lot of good water. And when you give the information, Professor Heimes told you in the first part that we know that we can give good information to water and that it's storing, and then you can drink, and it's really like energetic medicine for our patient. Okay, and when we said best support, then also I want to say it to you again. I told you when I talked about compact programs that you can add own information. For example, saliva or something else, blood, or when you have problems with the skin, a little bit part of the skin. It must not the bloody one that you are going with a knife very deep, only on the top of this, a little part of the cells, for example. And when you add this to your treatment, then you have an additional, very individual program. And in this program, what is inside of such information? It might be possible that you have pathogens, virus or bacteria inside of your body we have not in the system, because we have millions of bacteria all over the world and we cannot find everything, find the frequencies. But when you have part of the patient, for example, saliva or part of the skin, then for us, we know meanwhile, this information is given via the transferring frequencies to the organism, and it's an additional individual program. And for me, it's not sure what happens inside of the body with this information, but the treatment will be better, faster, and that is helpful. And therefore, please try it, and you will see it's another very nice possibility for supporting. Okay, green cards and home therapy. I told you a little bit when I started to explain. We have these green cards, and to work with the green cards, it's so easy because I'm not focusing on one treatment program. I like to have 3 treatment programs because for me it's clear the patient needs a lot of energy and he needs also very good detoxification and he needs his treatment program. And therefore it's nice to do that in a way that you create 3 green cards, that you're focusing one day, for example, on the energetic situation of the patient. One day is free. Next day you go to the treatment. You individually explain to you, or you take a compact program. One day is free, and then I'm focusing on the detoxification. For example, additional with the bath. And then you're working step by step with the main important things in the body to give energy, to support a good detoxification, and to take care for good metabolism with a treatment program. Therefore, it's nice to have these opportunities with all the green cards. In case that you have the patient in front of you and you're testing and you are finding out all the things, but then he said, yes, I like bioresonance, but because of the fact that the symptoms are so strong, I have to take medication. And what do you think? I have now to stop because of bioresonance, or what is your idea about it? And please, I want to tell you, medication sometimes can save the life of the patients. Or sometimes really they have so strong problems to the skin that with cortisone, for example, you can really reduce. Otherwise, it's not possible for living with this kind of symptoms. And our aim is really, or we are focused on reducing this kind of medicine. But sometimes it takes time. And for me, it's meanwhile really totally perfect to work with school medicine, with medication, hand in hand. And therefore I said, okay, first we are starting with our analyzing and developing of the treatment program. You have your medication, but because of the fact, you can also check this, you have side effects with your medication. I want to take care for these side effects. And therefore, I'm developing a special program. And you can see that here, that are, for example, digestive system, I'm integrated, liver complete, kidneys. Mostly these parts in the organism are damaged from medications. And when you use this program, for example, when you have the 3 programs, energy, detoxification, and the treatment program, then you stop, for example, detox, and you're organizing this program for supporting the people because of side effects. Step by step, when your treatment is working and the people are feeling better, then, for example, you can say, okay, what do you think about reducing the cortisone? Not one drop or one pill, half, for example. We can try. And in case that you feel good, then it's perfect. And that is step by step. The people come in trust with you, with the system, and then you can really find a good solution for them. But sometimes really my recommendation is to give a special program for supporting because of side effects. Okay, then we go to plant substances. I think everybody of you knows we have a lot of possibilities, and I like this system because of the many possibilities. And anti-inflammatory properties are so important, for example, for neurodermatitis, and that you can really find out good additional solutions. You can find out, for example, the right oil, or you can find herbals for a tea or something else. And it's so easy to do. You go to the RIH, for example, you have the program Neurodermatitis, and you have the linear movement. And then, for example, we take the organ oil, or we take other substances, put it in the cup, and in case that you have a rotation, you know it's a perfect support. And therefore, also from my side, the recommendation, use also these possibilities. Aloe vera, for example, is one of the things for the skin. Very nice argan oil, for example, balloon wine. We have so many possibilities. I'm not sure if is this in Canada, is it possible to get or to have? But I'm sure that you have a lot of new ideas. Try, find out, and in case that you can change from a linear movement to rotation, then it's perfect for the patient, and then you can support him. Next thing is also Schüssler salts. We have all the frequencies in our system, and therefore you can check all the frequencies, all the Schüssler salts, and in case that the radiotensor indicates, it shows a linear movement, then it's an indicate for need of this salt in the organism. Only to give you the idea. I'm not sure if you had tried it before, but hopefully after this presentation you will do it. My recommendation for neurodermatitis is number 6, 8, 13, and 24. But if you want to use it or find out the individual, please check it. Yes, stress. We come to another point, and stress is really triggering a lot of things. Also with asthma problems, asthma bronchiale and stress is perfect together. If the people have a lot of stress, then they start breathing and then they get problems with their bronchitis, with the lung. But same is also with the skin. And when you have stress, you are producing cortisol and inflammatory processes in the body, and that's the start of horrible things. Therefore, please think about reducing stress. And when I'm talking about reducing stress, I want to talk with you about the vagus nerve. You know, the vagus nerve is connected to all the organs in the body. And it makes sense to regulate him, to balance him, and that he is coming down and that he is showing in the organism that he said, okay, no stress, and we can focus on wound healing, and that we have not to produce, for example, histamine and all these stuffs. And therefore, please have a look at the vagus nerve. It's so easy. And when we talk about vagus nerve, one thing is to work with the frequencies. And I want to show you a very nice program. But the other thing is breathing. Breathing is really the way to coming down and for talking with the nerve, with the vagus nerve, and that you can give him a signal to balancing. And therefore, please start working with this kind of patients. And as you can see on the picture, very nice, they all need energy. And when you put the mini Ryonex really placed on the sternum during the breathing exercises, and the people have to breathe in the belly. And the mini is on the top, and they can look, and nothing has to move. But same time, nice breathing procedure, very deep, and the mini is giving energy. The people like that, to do that. And please believe me, the vagus nerve is very easy to balance in a short time. And in case that you have the possibility, then you have the detector on the floor, the people are laying on the detector, they have the mini on the top, and then you can run this program. Energy at the start, ATP production complete. Throat chakra is related to the vagus nerve. We have the vagus nerve. And I give also the tryptophan. L-tryptophan is needed for balancing, and also vitamins he needs. We cannot regulate with our frequencies, but in case that you eat or drink something, we can absorb them better from the food. Therefore, I take it in the program. Stress reduction, perfect program for this idea, detox and vitalization. Really, hopefully you try to do that, and we will have a feedback, because I like this program and we have many patients very successful working with that. Okay, that was neurodermatitis and atopic diseases. And the next thing is that I want to give you a little bit energetic support for cell degeneration. Many people are asking me when we are traveling around the world, and then it takes first I give the demonstration or, for example, a presentation. And when I ask them, do you have questions? And then they are asking about what can we do against cancer? Do you have a program against cancer? And I think really we have to talk about that. What happens? What happens in the organism when we talk about cell degeneration and about cancer? Cancer cells are deactivating the immune cells, and that is, for example, the problem for the immune system. They can block the self-regulatory signals, and that makes the cells cannot communicate in the right way. And for example, so detox or for taking energy, it's not working. Normal, for example, when you make such things, they are coming together, and there are special things for organizing, for talking the cells each other. But when you are working with cancer, you have the idea that it's like this. It's blocked. It's not working. And therefore, many regulatory signals are not working in the system. Cancer or tumors are promoting inflammation. I told you also before, inflammation is big problem in our body. We talk more and more about silent inflammation. When you have strong inflammation with pain, for example, on the skin, it's red here and pain, and then you can see it. And you're noticing and you can do something against it. But we have more and more inside of the body, inside of the joints, for example, inside of the liver inflammations. And these inflammations are really strong problems because the body cannot manage all these inflammations. The inflammations take a lot of minerals, for example. We need to balancing, but you are not eating more and more minerals. You have a little bit mineral or vitamins and all these things or amino acids, but very, very fast you come to a deficit, and then you have not the possibility to balance this inflammation. And the cancer is these tumors are growing and give the information that more and more things are giving to the tumor that he is growing. And the inflammation is also growing. Energy is the same thing. Cancer cells weaken healthy cells because they need a lot of energy and they stop the mitochondrial functions in working. And I told you the mitochondria in the cells are producing the ATP. And when these mitochondria are blocked, then you have not the ATP, and with the ATP, that's a big circle, and you're producing energy. And that is really not nice to know. But as you see, more and more, it's a big picture of the cancer. What is working in your organism in the bad way. And the influence of hormones and of the nervous system, the tumors really can stop the hormonal balance and activate the stress metabolism, and therefore you have no regeneration. These possibilities are also related to cancer cells. And therefore, we really, for a long time, we checked what is possible in supporting. We have the C module, cell degeneration. We are not allowed to say cancer. And as you know, for us, it's so interesting to know what is behind, to know or suspect the factors, to focus in a cause-orientated way and to find out the trigger. For example, electromagnetic pollution, geopathy, pathogens, nutrition deficiencies, pollutions, all these things are integrated. We have a general test protocol and a special test protocol related to special cancer parts. We have 87 programs, and you can check step by step, you can find out. We give not the name of the cancer to the device because really we are not allowed to talk about curing cancer. But at this moment, I also want to point out we are not, our focus is not in curing. We want to support people with cancer patients in the best way, same like with all the other diseases we have. And the cause-orientated possibility is really the big chance for these people. Please, I can tell you a story. When I checked somebody with a radioscan and we had the results, and you can see, so for example, that the people need amino acids, that they need vitamins, minerals, all these things. And then the lady asked me, please, can you tell me what is the relationship to these problems you find out in the scan and to cancer? And really, I had a little bit to laugh because it's not so clear for you. And she said, no. What is the relationship from magnesium, for example, or from vitamins I don't have in my body and cancer? Cancer is different. Yes, and then I explained it and I said, yes, but if you have for a long time no amino acids, no minerals and vitamins, that is might be the start of developing cancer. Because the organism and the immune system cannot work in the right way, and the defense is not working against cell degeneration cells. And for example, as you can see in the results, electromagnetic pollution is very strong. And more we come to the knowledge that electromagnetic pollution is not good for the organism, and it's also blocking the communication in the body cell to cell, and therefore it might be possible that if you have here the results and you change these problems, that you push your organism and your self-regulation against the cancer, or that you can avoid the cancer. Took a little bit time, but then she said, okay. And I think it was the first time for her to understand cause-orientated support. Because we are really looking behind the problems and we want to find out. And with the C module, same thing. We want to find out what is behind, what kind of risk we can or causes we can reduce. We have 87 programs inside, and the 87 programs, what kinds of programs are these? Pathology programs. We checked, same thing like with hepatitis or all the other diseases. People with the same cancer, we know that, and we checked with the single frequencies, a small step, and we find out the frequencies. We had the results. And at the end, for example, when you have 20 patients and you have the results, then you can see, interesting, the same frequencies were blocked. And you can find out a picture from frequencies, a pattern of frequencies related to a special disease. Because as we know, these blocked frequencies are the problems. And in case that we are harmonizing, the self-regulation is working in the best way. And that is the start of the right way. I'm not talking about healing, but supporting in an energetic view in the best way. And therefore, it's one thing is to support the problem if you have one, but it's also really good to avoid such a problem. And therefore, when you're checking somebody, it's very interesting, but please think about our system. We are talking about energetic problems, and the disease can be present, has existed in the past, or could develop in the future. It's not sure for you. As you know, when you are a therapist and you are working with the frequencies, same is with the bacteria or virus. You know you have the energetic problem, and then you can say, okay, you have symptoms. Okay, then you're closer to this solution that you have really a problem. But if you have no symptoms and you have, for example, problems with the pathogens, it might be past or future problems. Therefore, our aim really is for supporting and also for preventing. When you're not sure and you have the result, because many people are checking with cancer patients and then they said, okay, I have a bad feeling because for me it's not clear. Is it now present, for example, a breast cancer or something else? Then it's no problem for me really to say, okay, please try to go consult a medical doctor and let's check again. Sometimes really you can find first and then they go an MRT or a CT and then you have really the results. But in case that it's not that medical results from the medical school is the same, then you said, okay, we checked and we are on a good way to prevent this thing. And therefore, the people are very happy. Your possibility, checking first, to go in detail with the test protocol, to harmonize, to regulate, and it takes a little bit time. Also, when, for example, somebody had a tumor and he had a surgery, the tumor was putting out, you check and you will still have this linear movement. Yes, because the frequencies were not checked, were not changed. The tumor is putting out, yes, but the ground situation is still the same. Therefore, our recommendation, please talk about the reasons, the trigger, the deficiencies, all what is inside of the result of your after your checking. And the people have to change their behavior. Okay? In general, we can see we have the possibility to work with every disease, general diseases, systematic diseases, organ diseases, also with cell degeneration. And our recommendation is really first individual energetic testing or optimal support with self-regulation with RH and Bioresonance according to Paul Schmidt. And then you can find out the stress factors to relieve the immune system. Relieving the immune system is a solution for everything. Please believe me. Then you have to take care. We have special programs, 70s, Dr. Hammerter, fertility problems, for example, C-module, cell degeneration. We have special detox programs, ATP. All these programs are for special meanings, and you can find out if they are needed or not. Balancing all these things is so important, but in case that you have mineral deficiencies, for example, or you have an over-acidity, a lot of problems inside, then it's not enough only to do that with the frequencies. You have really to find solutions. You have to offer, for example, vitamins or minerals, and you have also to offer other things they need for the metabolism. We can push many things with the frequencies, but you need, for example, for the metabolism also substances, or, for example, minerals. You have to eat, you have to drink or to eat. We cannot only balance with our frequencies, but together, for example, with the products from Ryonex, we developed because our aim is really to optimize the therapy. And together we are strong because you find the problems inside of the test, for example, and we can offer a solution. And that is most important for you. Long-term energetic support you need to do for many things. Please don't think one time harmonizing and that's it, or 2 times or for 4 weeks. No. When the disease is longer than 2 years, for example, or some people have it for 10 years, then you have to say, okay, we are starting now and we are developing more and more, but sometimes really the people have to support their whole life. Kidney insufficiency, for example, we cannot renew the kidneys. But with our system, only to lay on the detector and to harmonize, it's perfect for them to balance that. Therefore, again, my recommendation to think about the products for supporting, because otherwise you have only the frequencies, it's not enough for support in the right way. Okay, alkaline minerals and pH regulation, cancer patients, I told you, because the cancer cells prefer an acid environment. And I told you that the people are asking for the right program against cancer. And I said, okay, I have not the right program, but my recommendation is Ryobase. And then sometimes they are laughing because, hey, Ryobase, that is so easy. Yes, it's really easy. You have only to drink in the morning, in the evening, for example, and that's it. But that is so easy to do, and it's important that you're balancing the environment and that you have not an over-acidity. And therefore, alkaline minerals, magnesium, calcium, potassium, and sodium, that's it. And therefore, it's my recommendation for preventing and supporting self-regulation and against cancer. The microbiome and cancer prevention, or we can talk many hours about that, because microbiome dysbiosis there are so many studies, meanwhile, that they are showing that we have really to take care for our microbiome. And therefore, a product like Bioflora, you need to do that, to eat it, to have that, because the bacteria, they have to develop in the small intestine. Otherwise, you cannot resolve from nutrition the right things, for example. And many, many, many problems are related to the gut, to the microbiome. And therefore, please, if you want, try. I have here a notice from a study, but we have many, many studies. Cancer and microbiome, I think you have to understand the relationship. Yes, and let's have a look to Canada. This time we are not face-to-face, so we are online. I'm so sorry because I like to stay in Canada. But I try really to find out what can you, especially in Canada, do for preventing, for example, cancer, or what are the special things. And for example, I found out you have really to take care because of your cold winter. It's so special. When we are there, we are in summer. And summer is the same like in other countries. It's nice, but not in other countries. We have such a strong winter. And therefore, please have a look at exercises. 150 minutes moderate exercise per week, it's perfect. And with the exercise, that is a possibility to give your immune system the power to work against all things, not cancer only, against all the other things also. Vitamin D, I think, is especially important between October and April in Canada, as hopefully you know. And sunscreen, let's have a look at the snow and the sunshine. And I think really skin cancer is growing also in Europe. I think you have in Canada, I think, same problem. Please, you have to take care. If you are not sure which kind of product is good for you or not, because in Germany, I know we have very expensive one and cheap one. And therefore, I'm thinking, what is the best for me? Because you need to be sure that the UV rays are not directly come to your skin. You can check with our device. You can have on analyzed preparation, you have a rotation, you give in the cup, for example, the product, and then you can check. Or you can directly go to the skin. You have a linear movement, you give the cream inside, you check it in case of rotation. It's the right one for you. Only to give you a little bit support. Let's have a look what you are eating. When I remember the breakfast in Canada, that is for me for the whole day. It was perfect, really, so many things, and it was very fine. But it was really with a lot of bacon, also with eggs and a lot of things together. It's nice to eat and we enjoy, but please have a look what are you eating. Convenience food, for example, frozen meats, hot dogs, once a week. Then it's perfect, but not every day, because inside are so bad. They contain really additives. They are so bad. And these kind of additives are producing cancer, or they're perfect for developing cancer. Therefore, take a little bit care about red meat. Also that in the bacon and in the steaks. The steaks are very fine in Canada, I know. Also with the fish, yes, but not so much. Have a look and think about acid and base, because when you're eating so much of this meat, you're producing a lot of acids, and you have to find out how to reduce. And then, for example, you need more vegetables and berries, less sugar. Also maple syrup, better than sugar, but it's still sugar. Sugar is also a big problem in Canada, and sugar is a little bit, you have to think about the metabolism, and it's blocking parts in the metabolism. And therefore, take care for that, not so much. What I can recommend is really to use this perfect nature in Canada. Please use it, forest walks, the lakes and the rivers, or mountain hiking. We are only for 3 or 4 days there, and I'm so sorry because we have not the chance to go into this perfect nature. But all these things are very, very good for your immune system and for fighting against cancer. Please believe me. You have to reduce a lot of things. You can relax in this perfect nature, and you have it really in front of you. Enjoy your Canada, your country, and your nature. One thing is only for me because I noticed the coffee. The coffee in Canada, I've never seen it before. Every time big cups. When you offer a coffee in Germany, you have a small cup. You offer the coffee in Canada, it's double or more. And if it's okay. I found out 3 or 4 cups are perfect. And with this coffee, you can, for example, reduce types of cancer, liver and colon cancer. Therefore, it's nice. But 4, 5, 6, 7 cups are not so good. Because then you changed and then you cannot prevent cancer. You are producing other problems. And when you can see that on the picture, there is also a coffee. But this coffee is hidden calories and inflammatory factors because a lot of coffee with sugar, cream or syrup, and all, it looks very nice, really, and I enjoy. But please, once a month, then it's enough. Otherwise, it's not supporting you. Yes, okay. That's it. I think lots of information. Hopefully you like to have this kind of information. And hopefully you can really go to your clinic, go to your devices, remember me, and then you start in a new way or in an additional way. Thank you so much.
Great. Yeah. Thank you so much, Mrs. Bunkenburg, for this amazing presentation. And thank you for adding on a Canadian touch to it. So, yeah. And so now let's move on to some questions that a lot of attendees asked questions. And again, time permits. We'll try to answer as many as questions. If anything missed, I will reach out to you and answer directly by email. Okay, so I have this first question. Any support in terms of hay fever, asthma?
What was the question?
Hay fever, asthma.
Hay fever. Yes, hay fever, asthma. We had at the start of the presentation, I told you, same thing. We have test protocols. You have the possibility to go compact programs, but you have to analyze what are the trigger for hay fever and also for asthma. And then you have to reduce. Same like neurodermatitis. I had in this presentation only neurodermatitis, but you can directly copy these recommendations to hay fever. Okay?
And next question is, what is the best way to hold rheotensor? Like some people hold it in front of the client, some people away from the client.
To what? What the stuff?
The rheotensor. Mm-hmm. Some people hold the rheotensor in front of the client, but some people away from the client. So why it's important to hold away from the client?
Away from the client because of, for example, his chakras. When you are too close, then you come, for example, to the chakras, and that makes no sense. Therefore, my recommendation is you have the device and you have, for example, to the right or to the left, you have the tensor, and then the little bit distance, and then you have the patient. Okay, not directly to him. That makes no sense because of lots of things. But you have also to feel a little bit comfortable. You need a little bit apart that you have space for the rheotensor, but not too close. A little bit far away from you. I think we have to show that. We need in the future. We need a little bit to show that on a picture. I think then it's easier. But it's not our recommendation to come in touch to the people. For example, with chakras and the energetic of the people, then you're going inside of these energetic fields, and that makes no sense for your test, okay?
Next, a very good question is how Ryonex bioresonance machines support in terms of allergies, like how it can support in terms of allergies, like maybe removing chemicals or...
Yes. What we can do, we can find out the trigger for the allergies. We can make a good detoxification. Mostly with allergy related is, for example, the microbiome. I can find out the reasons why the people are reacting with an allergy. And when I have the information, then I can, for example, say, okay, one thing is for harmonizing a lot of things to give you energy, to give a better detoxification. But the other thing is that we have to work on your small intestine and on the probiotic bacterials. And step by step, then we can regulate, and that is the way out of allergies. Mm-hmm. Okay.
Oh, thank you. Next question we have: how often do we need to do therapy, like in terms of hours a day or per week? And is 5 minutes enough for each program, or if it can go more, like 10 or 15 minutes for each, is it too much?
First thing, how often? My recommendation, meanwhile, really, because we are talking to many therapists, is really every second day. Because the burdens are very strong and it's growing and we have more and more problems. Therefore, 1 day treatment, 1 day free, 1 day treatment. Therefore, if it's possible, our recommendation is the home therapy. If it's not possible, 2 times a week. But mostly the people don't like to go to the clinic, they have to drive and they need to invest a lot of time. Therefore, more and more the people are accepting home therapy. You can see that on the picture, for example. They are really at home sitting on a detector or lying on the detector, and then they have the basic, and that is so comfortable. And that is the reason why they make a lot of treatments, and then at the end, they are very successful with the treatments. With the 5 minutes, really, believe me, we checked in detail. When we changed from the single frequencies to the RH, we checked everything, and also the time of harmonization. And we found out the harmonization is very quick and very strong because you change a little bit with the transferring frequencies. You know the special thing from the RH. And 5 minutes is really long time. Mostly it's 2.5 or 3 minutes. Many people are harmonized. But we said no, because of the fact that the people are different, then we decided to have it in 5 minutes. Mm-hmm. It might be possible that there are strong burdens, but mostly really not. Most people have enough. With a 70 program, I told you 10 minutes, if it's in a structure of a compact program, for example, or when you're only working with the 70 programs, 20 minutes if it's alone.
Okay. I can add the explanation from Ms. Bunkenburg in regards to the last research we made with oxygen availability, and we work with a breathing mask, yes, to check exactly the oxygen and other parts of the breathing air. And they said to me that the body reacts really totally fast, yes, to the frequencies we are offering from our therapy. And they said immediately, it means in a minute they can see the differences. And this is exactly what Ms. Bunkenburg said. 5 minutes is perfect. We checked that before. And the latest research shows exactly that we are right with this therapy time.
Great. Yeah, thank you. Another question. So in terms of global test human module, as you mentioned, it will be integrated in ReoScan in future. And I have a couple of questions asking when it would be available. I know everybody's eagerly waiting for individual scan.
Ms. Bunkenburg, you want to answer?
I cannot give the answer in the right way, but...
Okay, but I think we can explain the delay with the transformation of the bioresonance devices we did in the last 2 years. It means we started, the question is totally right. And it is not only the users who are waiting, we are also waiting, yes. But I can tell you that after finishing the Polar 4025 and the PS10 Plus, we started directly again with the software engineering of the new individual rhioscan, and we had a long meeting last week about that. Means this is completely in progress, and it is our hope that we can start the first beta versions or the first test internally here at Rhionex in September next. It means in the next month. Yeah, that is our aim. It means it is really in progress. It has our full focus now after developing the new devices. But that was the reason for the delay. Sorry for that.
Mm-hmm. Thank you. Next question is regarding the water. How does frequency, for how long they last in the water? And I will ask a couple of questions in the same sentence. So how long the frequencies last in the water, and how much do we need to take during the day?
Professor Heimes, you want to give the answer? You're the expert for the water.
For the water, okay. Yeah, indeed, we had a lot of research in this field, and it means normally this question will not take place because with a Rio Aqua and the water, I have that directly in front of me on my desk here, and when I need water, I'm filling it up directly to my glass here and drink that. Therefore, there is, I would say, no time delay between energizing and drinking. Therefore, this is of course the best way of the usage. Yeah, but of course we are able to use the energized water longer. But you have to know the time which is in between the energization.
I think there's some technical issue.
Yes, we cannot hear him.
Okay,
to use it over the day. Yeah.
Last sentence we cannot understood because of technical problems. Can you please say it again? No.
Oh, okay.
Okay, otherwise we will write it down.
Yes, for sure. I can always get back. And also, next question, almost for you, Mrs. Bunkenburg. Is there a difference between when we're running a kidney complete program different than running an individual RH kidney program?
A kidney complete program, or what was it? The other thing is
the individual kidney program.
Individual kidney program. Well, when I go in details and when I have the special programs, then I'm more focusing on parts, and it might be possible that you sometimes that you have more effects. In general, it's okay to have kidney complete, but when I know that the special parts in the kidneys, for example, have the problem, and I can offer that with the frequencies, then I go really also in detail. Same with other organs. In general, perfect. But if I have the knowledge, what part, then I can really go deeper. And that might be the focus with the frequency is then a little bit stronger.
Great. Yep. Thank you. All right. I'll move on to the next question. How many? It's again Professor Heimes' question. Maybe he can add on and maybe follow up with the last we missed regarding the water. How many frequencies or RH programs we can store in the water, like transferring them?
Yeah. Okay. It means the biggest outcome of our research was that water is not only able to store frequencies, also I would say the shape of the frequencies. Yeah, that is a giant result of the research we did, and very important for us also. But we had nearly no limitation. What we checked is 500 different frequency-based values in one water, and it worked proper. And therefore, I think that there is no really limitation, because water is an unbelievable huge storage system for frequencies.
Oh, that's great. Thank you. My next question is for Mrs. Bunkenburg. How this Ryonex bioresonance devices can help in swelling, inflammation, and high histamine response?
In swelling inflammation?
And high histamine response.
High histamine. I think like in all the other things, when I'm checking somebody and he has the problems, then I want to find out sometimes I find the problems behind the disease and the symptom. And that sometimes is the reason, or it is a possibility for supporting. Okay, that for me, every patient we are checking, that is a whole picture. And then I said, okay, interesting. I can see in your body these and these and these things are not working. And that might be the problem, that you have the big problem with the histamine, for example. Mm-hmm. And that is the way you have to find out. Sometimes when you said, okay, this problem is such a big thing and we cannot make it something new or change it in a different way, but the trigger behind or other environment problems can be the reason why the people have this problem. And that is the Ryonex solution, to find out and to find out.
Yes. Like look for the causes first, because it's a Ryonex cause-oriented treatment is the sustainable. Yes. All right. Great. And next question also related to some medical. Can you please explain if extra support is needed for amino acid or enzyme disturbance other than the bioresonance?
Amino acids, for example, when you have to find out, is it possible in case that you take them and they are not, we have no resorption, then you have a problem with the small intestine, for example. You have really to find out. And if you need, you have to take some. We have a lot of products in the market. And I'm checking, same like I told you with the plants or something else. I have the problem, I put the product in the cup, and in case that I got a rotation, that's the right one.
Yes.
Okay?
Yep. Thank you. Okay, there's a question on the cancer topic, cancer prevention. So you are recommending, you recommended sunscreen. So what about the need of sunlight for health? Do you think lack of sunlight can play a role in health, especially in Canada?
Sure.
Yes. All right. Okay. Not many left. If you're in a clinic following RAH program with Rayotensor, if not harmonized after 5 minutes, is it recommended to stop after 5 minutes or run 5 minutes again?
In case that it's not harmonized, then you have to make it longer. Harmonization is important, okay? A little bit harmonized is like a little bit pregnant. It's not possible.
And sometimes I believe, if correct me if I'm wrong, they go back to the same environment where they need a regulatory support. Then mini can be also helpful for.
That's it. A mini you can wear directly close to your body, and then you have better support all over the time. Therefore, perfect.
I think that the question can be related to the situation that when we are using, for example, compact program with 5 minutes of treatment, then it can be that at the first treatment it is not long enough. But we are treating, like Ms. Bunkenburg said before, that after 2 days, the next treatment is coming, and then the treatment comes over in 5 minutes again, and 5 minutes, and then it is really enough. That is the reason why it is working so proper.
Right. Thank you so much. I know we are already close to our 2 hours mark, but I have 4 more questions left, if you don't mind. Okay, so about I'll come back to the water charging question. There's a part we missed. How long the frequencies last in the water?
It means we are. Please let us talk at first about the ryotabs. We are using the ryotabs for approximately in a maximum time of 14 days. Yeah, that is exactly the time limit with ryotabs. Our experience with water is not so long. Yeah, it means it is the ryotabs has definitely an advantage, but normally you have to use it as quick as possible. It means that is the point. When you are energizing the water and you're using it today or tomorrow, then it is perfect. Yeah, then it is really perfect. Because the intensity is going down and down over the time, because in the water is not a dipole antenna system, which is producing the frequencies permanently. Yeah, it is storing, and then environmental influences can reduce the intensity. That is the point.
Right. Yeah. Thank you.
In oil and water. I saw the question.
Oil and water. Yes, both. Okay. Yeah. Similar way, the ryotabs work similar way because storing the frequency. So ryotabs can be the best example. And next question is regarding pancreatic cancer. Is there a support?
Same like with all the other things. You have to analyze somebody and have to find out where are the problems of these patients. It's the same with every cancer and every disease. And in the same way, I would support him to find out the problems, to develop an individual program, for example, and then to give this program, but also take care for the nutrition, to avoid electromagnetic pollution and all these things. Same like for all the other patients. Okay.
Yep. Thank you. I have just last few questions related to some technical. So majorly for Professor Heimes, are these Rayonex bioresonance devices, which is Polar and PS10, are medically approved, have a certification for both diagnostic and treatment?
It means the medical usage of the device is related, and the registration is related to the treatment. It means the treatment from a Polar made or a PS10 made. Yeah, and for that we have the certification. Yeah, of course. We have also with realizing the studies, the claims for example, shoulder pain, for back pain, for migraine, and whatever. But in real, and this is, I would say, the difficulty, to have for each disease a clinical prospective double-blind randomized study, a gold standard study, which costs, I would say, up to €1 million, is nearly impossible. Yeah, and therefore this is a normal usage to have exactly, I would say, a disease and a gold standard study related to this disease to show that the usage is significant and also safe. And this is exactly what we did. And for that we have this medical registration.
Perfect. Thank you so much. Last question. How Rayonex bioresonance devices are different than other in the market? Like, for example, there's a Scholar machine, Scholar based on Scholar waves, like RAI for spooky.
Yeah, the first is we never will name our products spooky. Yeah. This is the biggest difference. Of course, this is so crazy. No, but the point is, we want to change the medical market. We want to change the world, the medical world, with our systems. And for that, we need a fundament as a medical device. Yeah, so many devices are out and you know, I'm really an engineer. Yeah, and we try to explain it physically, mathematically, from the electrodynamical point of view. And this, I would say, is the biggest difference to all the others in the market. When you are asking them, how is the system exactly working? Then they are trying to explain it to you, and the technician will say, what a nonsense. Yeah, and we have now this physical fundament so that we can explain how it is working, what is the reason why it is working, and we can explain why it is working, and we can parameterize also the system to optimize it. And this is the biggest point for the future also. Yeah, it is a science point.
Yeah.
Hmm?
Perfect. Yeah. I think we have covered all the questions. If anyone still have any questions, please feel free to reach out to me, and I can directly answer your questions via email. Again, thank you so much, Professor Heimes and Mrs. Bunkenburg, for your time and for this webinar. And again, thank you for all who attended our webinar and taking the time. So, and yeah, again, if any questions, feel free to reach out to me, and I can now always directly answer your questions.
Yeah, our thanks is to you. You organized it.
Thank you so much.
Yeah,
thank you so much for listening.
All right.
Okay.
Yeah.
Thank you.
Thanks.
And take care.
Take care. Bye-bye.
Take care. Bye-bye.
Bye-bye.
Okay, bye-bye.